Welcome to the Supporting Young Hearts, the Heart to Heart series, a podcast to help support the emotional health and well-being of younger adults living with a heart condition, have had a heart event or heart-related surgery. The Heart Foundation acknowledges the traditional owners and custodians of country throughout Australia and their continuing connection to land, waters and community. We pay our respect to them and their cultures and elders past, present and future. I'm your host, Carlye Weiner, a clinical psychologist working alongside the Heart Foundation with a special interest in young people and chronic health conditions. Throughout this series, we want to support, connect and inform you to help you best manage your heart health and emotional well-being related to the unique stage of life that you're in. For more information about what we discussed today, or if you need further support, please see links in the show notes or visit heartfoundation.org.au. In today's episode, we talk about what happens when you're diagnosed with a heart condition, coming to terms with your heart condition, and how this changes your world as you know it. We talked to Ange Foster and Geoff Lester. Ange was 38 when she was diagnosed with severe dilated cardiomyopathy, a disease of the heart muscle where the heart can't pump blood as well as it should. Since her heart journey began, Ange has become a Supporting Young Hearts advisory group member and advocate to empower young heart patients to be informed and educated about their condition. Our other guest today is Geoff Lester. Geoff was 24 when he underwent the first of 3 open heart surgeries. His experiences eventually led to a decision to change his career path and saw Geoff begin studying medicine. He's now working towards becoming a cardiologist so he can help others with similar conditions. Geoff, Ange, thank you so much for joining us. Today we're going to talk about some deep, heavy topics, and I know both of you are such advocates for talking about heart conditions and health conditions in a whole person way. So I'm really keen to hear both of your stories. And I'll start with you. Tell us a little bit about your heart journey and how you've managed to integrate it into your life.
Well, thanks for having me, Carlye. It's a really big question, like you said. My heart journey is one of a couple of other conditions that I manage. So when I had my diagnosis, it was a shock and a surprise, but it's something that I felt I was well supported to take forward and understand. But I think the most important thing for me that I learnt on this journey is being an advocate for your own health. And by that I mean asking questions, finding out the answers if people can't tell you, and sort of reaching out to others to sort of help you understand and navigate the new world that you're in. So it's very overwhelming being diagnosed with a heart condition, especially as a young patient, because there's lots of terms and situations you're not used to. So I think being able to talk to your support team, talk to your doctors, your cardiologist about some of the questions you have, that's what's really helped me understand what I'm dealing with.
So information is key for you?
For me, yes. Wanting to know about my medication, what does it do? What sort of information can the specialist share with me about other young people going through this condition? And, what's my prognosis? That was a really tricky question for my doctors, and that's what I wanted to know. I wanted to know, what is this condition? What do I have to do to help myself and make sure my body has the best chance at recovery? And what does prognosis look like? And, it's not a perfect science. As many of you who are listening will find out, everyone's individual. So I think that was the most challenging thing, is that no one could really tell me what my journey was going to look like. And so I thought, okay, how can I take control of that? So the main thing I could do was listen to my doctors and my specialists, take my medication, and ultimately put myself first, which was not something I was used to doing.
You approach your health with such tenacity. You want to know the answers, you ask all the questions. Have you always had that level of confidence?
No, God, no. No, not at all. It's funny, a lot of people will say to me, oh my God, Ange, you're so confident. Like, you just ask questions. And I'm like, I'm not a confident person. I'm just really inquisitive, and information helps me understand the world. I'm by no means a bookworm. But I think when it comes to health, because as I mentioned, I've had a couple of other health conditions before this one, I really understood and felt comfortable being in a hospital or in a setting with a specialist. I've been through so many other specialists and health conditions that I had become a little bit used to, what to expect in a consultation, what types of high-level information specialists give you when I really want a bit more of the detail. So I think that did set me up well to feel as though I could be confident with asking my GP and my cardiologist what was going on. But for the first 2 weeks, I was not asking one question. I was just taking it all in, and there was a lot to take in. The questions for me came once I was home. So once I'd gotten out of hospital, I had my medications, like they'd stopped adding extra medications every day. So I now had my full suite of what I needed to manage, and sort of like a checklist. So the pharmacist gives you a list of medication when you leave a hospital. So yeah, I just really spent my time sleeping, looking after myself, trying to allow my body to get used to the regimen and cocktail of medicine I was on, and really just sort of taking it one step at a time. I reflect on it now, and there was so much paperwork to read, so many forms to fill in. I was worried about returning to work as well. And for the first time in my life, I struggled with concentrating and being able to digest all the information that was being thrown at me. So yeah, I had a bit of a slow patch there, but I picked up and I became more confident. Day by day, the more I understood, the more I researched, the more I felt I had a connection with my cardiologist and could ask her a whole lot of questions, the more confident I felt with exploring the new world I was in.
Yeah. And walk us through what age and life stage you were at when all of this was happening.
Yeah, sure. So I was in my late 30s. I was first diagnosed with a chronic health condition in my mid-20s. So I guess, I'd had sort of 10 years of managing Hashimoto's disease, which affects your thyroid. So with that comes fatigue, and I take medication daily for that. And it's something that needs to be managed and monitored quite closely. As we all know, hormones in our bodies can be affected by lots of different things. So I really felt that, I had that under control. And I also have fibromyalgia as well, which is a complex condition that sort of deals with fatigue, depression, and muscle aches, pains, and challenges there. So on a daily basis, I would feel very tired. So yeah, with all that on board, I kind of thought, things are going well. But then, whammo, I was diagnosed with dilated cardiomyopathy, so severe left ventricular cardiomyopathy. Basically, the heart doesn't pump as well as it should, which leads to a build-up of blood in the left chamber of the heart. And so, all the blood that we need to circulate and oxygen we need to circulate around our bodies, it's not getting where it needs to go. So it fills up the heart, it becomes enlarged. That then puts a lot of pressure on other organs in the body.
So you speak about approximately 2 weeks where you're in a bit of a state of shock trying to get your head around things. Mm-hmm. What was that like?
Honestly, it was a blur. Like, I look back to it now and I feel like I was in a bit of shock and I wasn't my normal self. So as you can probably tell, I like to chat and talk to people and interact. When I'm in an environment I'm comfortable in, I was not comfortable in the environment I was in, and that really affected me. It's the first time I'd ever been in hospital. I was wheeled up to the cardiac ward at like 2 a.m. in the morning, so I had no idea who I was in a shared room with. When I woke up in the morning, I realised I was in a shared room with 5 men, all in their 80s. Some of them spoke English, some of them didn't. And that was hugely isolating and scary, because I thought to myself, am I in the right place? Like, where am I and why am I here? And so, yeah, I felt pretty vulnerable at that point.
Yeah. And at the same time, you knew what you had to do in terms of what questions to ask and what was important to know for you as well.
Yes and no. I was given a booklet. So after my heart biopsy, and they really said, yes, you've definitely got dilated cardiomyopathy. It's not caused by a virus. We don't know why this has happened, but genetically you need to get your family tested to rule out anything, but we think it's just happened. You're one of the unlucky ones. And they gave me a booklet. And that booklet was a big sort of A4, 25-page booklet from the Heart Foundation about heart failure And I tell you, I read it from cover to cover. I was going through it. I was circling questions. I was taking photos and sending it to my parents back home in New Zealand, who were also struggling to understand what was going on with their daughter over here in Melbourne. That booklet was really good for me because I wanted to digest information and understand. So I think for me, that was fantastic. Otherwise, I would have been jumping straight on the internet. And that's probably not a great place to start when you're researching cardiomyopathy.
Yeah, you had really credible sources and you used your voice to be able to ask the professionals in front of you, hey, these are the questions I want to know.
Absolutely. And that was like that first layer was understanding the condition. The second layer that was a lot harder was like, okay, I understand my condition. Now I want to understand how to live. Like, how do I live with this condition? How do I return to work? How do I operate my social life? What about having children? Like, all of these things then started to come up. So yes, that booklet was great for the baseline understanding, but I think my journey really started at that second level, understanding how to navigate life again.
Yeah, and how did you do that? You're in your 20s, 30s, You had a lot of questions. Presumably you had, life mapped out or a direction you thought you were headed. What happened then?
I don't know. I don't have a life plan. I don't have, like a vision board or anything like that. I think it's just subconsciously the things we hope for and the way society sort of moulds us into expectations we have of ourselves. So, starting a family was a plan I'd always had. So I was really lucky. I met my husband really young. We're both at high school and we moved to Melbourne together and got married and started our lives together, and I'm really lucky that I had him by my side this whole time. I guess the thing was I'd always thought in my head we would have a family, we would have children. And having been diagnosed with Hashimoto's disease, I was diagnosed with that when I started trying to start a family. I had no idea I had this condition, and that was what was making it extremely hard to have a child. So in my mid to late 20s, I kind of reconciled the fact that, starting a family probably wasn't on the cards for me unless we went down the IVF route or, specialist fertility. And because I had so much else going on at the time, we sort of just put the family idea to one side. I focused on my health. But yes, being diagnosed with cardiomyopathy, one of the first things my doctor said to me is, you're a woman of childbearing age, and this means you can't sustain a pregnancy. It's a very clinical conversation. And I kind of said, like I in my own head had said and thought, well, it's off the cards anyway. So, I kind of thought, right, well, that puts that completely to bed then. There's no real chance of starting a family. And while I grieved for that and I felt sad about that, I also have the optimism in myself and my positivity to say, well, that's not my life journey. There's something else out there for me. So I don't mean that to sound flippant, because it is a big thing for a lot of people going through this condition, particularly females. But it took me a while to get there in my mind. But I think because I'd already assessed my health as a priority over any dreams I had of starting a family, that's what got me through. There are still days where I think, gosh, what would it be like if we had a little tacker running around? But I'm very happy with my life because I'm here and I have a life to live. So I want to make the most of it.
I love that you appreciate your own life, and despite so much grief and anger and pain that you've been through, you have this air of gratitude about you.
Yeah.
Tell us a little bit about that.
I don't know. It's just me. I am a very empathetic person. And I think in my early 20s, I thought I was bulletproof and, I was all about my career. That's pretty much all I did was work hard, play hard, had a great social life, and I've had a great life and I will continue to have a great life. But, being forced to slow down in my late 20s, like I said, that helped me prioritise things. At that point, I sought help. So I saw a psychologist, pretty much every every week for 2 years, grieving the fact that I couldn't have children and what that meant for me. So I knew the importance of speaking out and allowing myself to talk it out, because I am a talker. But I don't know, I just feel incredibly grateful for any part of life we experience. There's always someone worse off than we are, or someone that can't necessarily navigate the world the same way that we do. And I've always had that. I think that's a testament to my wonderful parents, who taught me the value of everything in life, never to take anything for granted. And so, yeah, I always look to how I can support and help others. And that's particularly why I'm happy to be part of the Supporting Young Hearts program, because when I came out of hospital and came out of my fog and wanted to start connecting with people, I thought, how can I pay it back? How can I pay this forward? How can I help others who may be in this position right now that I was in a few months ago, and help them understand they're not alone? And so that's always been part of my value set. But I feel so passionate about it now, and I'm so grateful to be part of the advisory team so I can share with others who might be going through similar struggles.
And there's something about you, Ange, that always seems to feel so passionate about taking charge. You're such an advocate for yourself and an advocate for others, and you just have this aura around you that is just so bright. You know, you've got such an optimistic attitude. So I dare say a lot of people would really benefit from hearing your journey and feeling inspired to keep going.
Yeah. I mean, look, I really appreciate that, Carlye. It means a lot. But I also have bad days, you know. I want people to understand, like, it's not just Pollyanna on the end of the mic here. Yes, I'm optimistic and I'm very passionate, but I have bad days. But I think the difference for me is I acknowledge those bad days now, and I don't feel guilty about having a bad day. It's just another emotion. So I've been taught, you know, through help from my peers and my psychologist, you know, feeling down, feeling depressed, it's a normal human emotion. It's about how long we stay in that state and how we can support ourselves to move on from it. So I have bad days.
You are such a resilient woman to roll with the punches.
Thank you.
And I do want to get back to your version and your advice on managing your health, because you do have this sense of whatever you're going through is okay, which I think is a really important message. I do want to jump to you, Geoff. And I know that you and Ange know each other and have very, similar outlooks. And I want to hear about your story. And yours is a little bit different in that you really took your heart journey to the next level and decided to give back in a different way. So tell us a little bit about you.
Yeah, thanks, Carlye. I mean, I think Ange resonated. What she said resonated quite a lot with me, and it's about having gratitude and being thankful for what you have. And I certainly I can't speak highly enough of that approach to life. At 24, I was not in where I am now, and I had a spontaneous dissection of my aorta. So the large blood vessel supplying blood to the body from the heart tore open. And I was rushed to hospital where I had emergency surgery. So from my first ever symptom to open heart surgery was about an hour and a half. Thankfully, I had an aortic valve replacement at that time. And thankfully, I survived that operation. And after that, I was laying in my hospital bed, thinking what my life meant, what it had become, where I was going. I think possibly also a little bit naive about how lucky I had been to be alive. Obviously, I now know that, but at the time, you know, you're 24 and you're invincible, right? You know, and so you think, what can I do with my life, and how can I contribute to make something of my life, given I've had this second chance? And it was such an epiphany, such a kind of incredible moment where I decided that I wanted to be a doctor. I wanted to find out how this had happened to me and stop it from happening to others. But then 9 weeks later, I had some more pain. And so my GP, who was kind of a bit cautious and appreciably so, suggested that I go to the hospital just to kind of make sure things are okay. And I had another scan where the next person I saw was my previous surgeon, who said, you have to go back to surgery. So here I am at 24, being told I'm about to have my second open heart surgery. at that point you feel a bit less invincible, but still confident in the abilities of the team and confident in what they had achieved previously and what they could achieve this time. So I had my second open heart surgery. Since then, I committed to becoming a doctor, and I got into medical school in 2012. And then in 2013, I had a dissection of my vertebral artery, which is the artery that runs up the back of the neck, where I had some paralysis or some weakness in my left arm, and we never knew where and when that would come back. Eventually, it did come back. And so I was thankful after a period of 6 weeks that I got all my neurological features back. And then I managed to finish medical school. And then in January of my first year of general registrar training, I was at the gym and I had another stroke. And I had complete right-sided weakness and loss of my body. So at this point, I was 33, complete weakness of my right side of the body. I was rushed to hospital where they had assessed that I was not having any blood supply go up the left side of my neck to my head, and it was all coming from the right. And I just pushed that beyond what it was capable of doing. So it was just a weakness of blood supply to the head. And at that time, they also diagnosed me with having had a large kind of hematoma, a large blood clot inside my chest. But because I'd had 2 previous surgeries, they didn't want to rush in and do anything. They said, we just monitor that. That lasted a week before I went back to hospital with chest pain. And they scanned me and realized that this clot had grown. This is right next to my heart. And said, look, we'll need to operate. We're not sure how quickly, or not sure when, but this time it's not an easy operation, I can tell you that, and there's a really good chance of it not going well for you. Bearing in mind I'm now a general registrar, I was close to achieving, on the cusp of achieving everything I wanted to do for the last 11, 12 years. I was with the love of my life. I was in a fantastic relationship, and life was going well, and I just got to where I wanted to be. And he was saying to me, look, there's a good chance you might not make it through this operation because it's complicated. You've got complicated anatomy. I had open heart surgery after that chest pain, and that was a rushed procedure as well. They did a CT, had the chest pain, went straight from the CT scanner straight into my third open heart surgery at the age of 33. And so since then, I've been completely fine. I exercise every day. I wake up thankful that I've got that day. I live every day like it's my last. And this year, I'm in my first year of unaccredited cardiology training. I can feel it. Like it's stiff, the finish line, I'm not there yet. I've still got a few more hurdles to jump, but it's to be able to deal with patients who are like me and to be able to approach them in a slightly different way to the average, medical professional who hasn't had a lived experience is a genuine privilege, and it's an absolute calling. And I'm so thankful that A, I'm alive, B, I'm in this wonderful profession, and C, that I get to treat and chat with people who are as lucky as I am.
Well, firstly, congratulations. You have been through a hell of a lot of trauma and a lot of setbacks along the way there. And you've kept persisting. And I can hear the passion in your voice that you just want to give back, and the gratitude. I love that you're saying, like, every day, live it like your last, and that you can appreciate all that you've been through. Both of you speak about curiosity being really important throughout your journey, whether it's asking for information, asking the questions. Geoff, for you, it was about learning. What would you say to people that maybe get stuck on their heart event or heart condition? They might be going on a loop with grief, this wasn't the life that I wanted for myself, or anger, why did my body do this to me? Did you ever face any of those emotions, and how did you overcome them?
Yeah, I certainly did, especially after the first one, and of course after the second and the third. I think in my situation, I've overcome that by applying that to my vocation every day. I feel like that makes me and has made me a better doctor than I otherwise would have been, and a better patient advocate than I otherwise would have been. And I think actually each day that you see patients who have these medical events much later in life, they kind of look back and go, God, I've got some regrets. I should have done this. I should have done that. I wish I had more time. And I think the benefit of being so young and having this happen is that life has flipped upside down for me in that this has happened so young. I'm lucky that I can now look at life every single day, knowing it can be short, with firsthand lived experience, and approaching life in a way that when I get to 70 or 80, I can look back and go, yeah, I made every day a winner. I made every day a winner.
Absolutely. So you think so far forward and it's almost like avoiding regret. Like you want to make the most of what you've been given. And you pivoted the hell out of your condition, didn't you?
Yeah, absolutely. Yeah.
And although you had grief and anger and no doubt so many emotions along the way, you turned it into a passion and you express those emotions every day through the work that you do, and have found a way to make it helpful for you and integrate your life in a really healthy way.
Yeah, you've nailed it. Yeah, that's exactly right.
And Geoff, I speak for all of us when I say you are going to be an amazing cardiologist, and it's so exciting to see what you're going to do for yourself and for others.
Thank you.
Yeah.
I really hope so. Thank you so much.
Thank you.
Yeah.
And I just want to jump back to you in the spirit of channeling emotions and channeling something for the better. How have you channeled your experience?
I think what Geoff was saying really resonates with me. You know, it's about purpose. It's about finding what makes you happy. And I think when you're diagnosed with, you know, any sort of medical event, let alone a heart condition, it really makes you focus. You know, it brings it right forward, front of mind. As Geoff said, each day is a blessing. And sometimes it doesn't feel like that. You do have sad moments and frustrations with what your body can and can't do. But ultimately, I feel like Geoff, I feel lucky that we've been given this opportunity early in life to have that focus. So for me, it's about what makes me happy. Yes, I have to work, and yes, I have lots of other commitments in my life, but I prioritise based on what makes me happy and what gives me purpose. And I think being able to connect with the Supporting Young Hearts group, I've found like I've got a purpose to help others. So like Geoff, obviously turning into a fantastic cardiologist, that's his way of channeling it. For me, I channel it in how I can help others, how I can support others, how can I help others navigate this, and turn my experience into a positive.
Wonderful advice. Well, thank you both. You have both shared such inspiring stories, and I feel uplifted, even though despite what you've gone through. So keep sharing, keep advocating, keep pursuing your passion, and good luck.
Thanks so much.
Thanks,
you.
God, I wish I didn't say good luck.
I noticed you were searching for the right word to say there. What are you going to say here?
And good night. Thank you for listening to the Heart to Heart series, brought to you by the National Heart Foundation. Special thanks to the Supporting Young Hearts Advisory Group, who help guide the work of what we do, and the members of the Supporting Young Hearts community who have openly and fearlessly shared their stories and experiences to help others through their heart journey. This podcast was made possible by the Victorian Government Let's Stay Connected grant and was developed with you for you. For more information about what we talk about today, or if you need further support, please see the links in the show notes, call the Heart Foundation's helpline on 131112, or visit heartfoundation.org.au. Advice and information given by the Heart Foundation is for general information and education purposes only. It does not constitute medical advice. Please consult your healthcare provider if you have or suspect you have a health problem.
This podcast was produced in collaboration with Joy, Australia's Rainbow Community Media Organisation. For more information on Joy and our services, visit joy.org.au.